to introduce himself, where he's from, as well as what he does. I'll hold it.
Okay, great. Sorry, my name is Vince Blaser, and I'm the director of the Frontline Health Workers Coalition. It's a coalition of 34 U.S.-based organizations that are working on health workforce advocacy for developing countries.
All right, Vince, I hear that there's something to look forward to this week in relation to healthcare workers. Can you take us through a little bit of that?
Yeah, sure. So as some may know, in the SDGs last year, there were two sub-targets in Goal 3 that were specific to health workforce. Goal 3C, that it calls for increase and attention to the number of health workers needed to achieve the entirety of the SDGs. And there is also Goal 3.8 that's specific to universal health coverage. So obviously those two goals place a tremendous burden to solve one of the greatest hindrances that there has been to making greater progress on global health, which is the lack of trained and supported health workers, especially in rural settings and in resource-poor settings in urban areas. So there's been a couple of really great things that have happened over the last few years to gain momentum. One happened in May at the World Health Assembly. There was a global strategy where all the countries of the world came together the first time on a global health workforce strategy. It's called Workforce 2030, that sets a framework for what countries have agreed to do to get a fit-for-purpose health workforce that we need to achieve the global goals. So that sets out the framework, but of course, investment is what's needed. So the Secretary General of the UN in March commissioned what's called the UN High-Level Commission on Health, Employment, and Economic Growth. They're supposed to look at the economic drivers of investment in health workforce and what are some of the investments that are needed and how we could possibly do that. So that commission's report is going to be unveiled tomorrow at the UN from 4 to 6 p.m. It's going to be webcast on the UN channels, and so we're really looking forward to seeing what that commission has to say and seeing as us as advocates how we can utilize that to ensure that those commitments are made.
Awesome. I hope we will try to make it there also for the launch. And just really briefly, what are some of the actions, perhaps as well as commitments, that international, national, as well as local leadership needs to commit to achieve the SDGs? What is the call to action that you maybe have with them where health workers is related?
Yeah, sure. So a World Bank and WHO report came out last year that said at least 400 million people lack access to the basic essential services that are needed that are needed to for a healthy life. And so with that many people, what that essentially is saying is that they lack the health workers that are needed to provide those services. So what we're calling for is that there needs to be a far greater attention paid to supporting those local health workers who are on the front lines of care, to getting them both not just the training and pay that they need, but the equipment and support and connection to the health system. And so with a greater focus, and countries that have shown that greater focus on that frontline health workforce saw tremendous progress towards the MDGs. So if we want to achieve the SDGs, we really need to focus on those front lines of care, and that's our continued call to action.
All right. Thank you, Vince.
Thank you so much.
All right.